David Lopresti. I'm an interventional radiologist, and I got into medicine in 1997. Right after medical school, when I graduated the University of Colorado, I went into the Navy. My dad was in the service, and I always wanted to serve myself. I had the opportunity to go through the Dive Medical Officer training course, which was wonderful, and I worked with a group of Marines at Camp Pendleton, which was First Force Reconnaissance Company. That was one of the best jobs of my life. I loved it. My time in the Navy was exciting. I got to do a lot of different things and quite a bit of travel. After fellowship training at UC San Diego, I deployed on the Comfort Hospital ship to Hurricane Katrina relief. And then I also had the opportunity to deploy on the Mercy in the Southeast Pacific, Southeast Asia area. Navy was a wonderful time in my life. I reached a point in my career where to progress I would have to have gone the administrative route, but I love being a doctor. I've always been a hands-on person. I like working with my hands and seeing what I can do. Whether it was art as a kid, molding clay, those types of things have always been fascinating to me. My path through radiology was interesting. I think that it was incredibly interesting on a technological scale, or in regards to technology. The computers that were being used in medicine to manipulate images were very attractive to me. But once I got into radiology, I realized that I missed my patients and I missed the ability to affect things with my hands. So interventional radiology was a perfect outlet. And once I got into that field, I knew that this is what I wanted to do for the rest of my career. It's been a fantastic field to be in, a tremendous amount of innovation. It's the birthplace of angiography. It's the birthplace of interventional cardiology, interventional neurosurgery. Just a great field to be a part of, and certainly never boring. With the ability to treat all these different disease states, we cross over many different disciplines, so it's collaborative with other types of doctors, and I love that about this field. My favorite thing to do at this point in time is vascular intervention. That's where we go in and we open up arteries that are blocked, usually to the legs of a patient. And that is manifested in a few different ways. They may have cramping pain when they walk. They might get pain in their feet. Sometimes that's worse at night. And one of the worst things that happens is they can get ulcers. And those ulcers then put them at risk of losing that limb. So the ability to go in, open up the arteries with these techniques that we have that don't involve incisions. I mean, we're talking about pinholes to make things happen. It's a blessing to be a part of. One of the things that's very important to me when I meet a patient is I will talk with them for as long as is needed to find a connection, something I can relate to them about, and something that I can then feel, sympathize with, or at least empathize with. And then when I've made that connection, it's nice for me because I guide them through their care as I would my family.